So tell us about Ehlers-Danlos generally,
Yeah.
rather than hypermobile EDS.
Yeah,
Why are there 13 categories?
Well, that's a good question. It's one of the connective tissue disorders, and the 12 of them are quite severe. One of them carries high mortality and morbidity, and that's the vascular one.
Yeah.
So whenever I see someone where I suspect that they may have either classic or vascular Ehlers-Danlos, I always send them for genetic testing because we can test for that.
Right.
And those are people who are at risk of rupture of internal organs at a young age.
At a cellular level, what's going on?
Well, it's basically the matrix of everything in our body is made up of collagen. And the collagen is faulty in people with Ehlers-Danlos. So I often explain to patients that it's like the glue that you have in sticky notes. It just doesn't hold very well. And once you've damaged the ligaments or the muscle tissue, it never grows back together the way it was. And it'll always be weaker than before. Whereas normal people have super glue in their
Sure.
collagen.
So when we're talking about vascular or generalized?
Classic
EDS, classic
yeah.
EDS. What's being, vascular, I can understand what's being affected. Does this mean that the blood vessel walls are less robust?
They are very thin and very much at risk of rupturing. So these are the people that have spontaneous rupture of, for example, an aortic aneurysm at a young age.
Okay. So the obvious question from that is then, well, how would you recognize it?
Well, you couldn't necessarily. They have more like blue sclera in the eyes, and they have more see-through skin, so you can see the veins extremely clearly. Right. That's one of the things that point out. And then they have the extremely hyper-extendable skin, where you can pull it. Classic Ehlers-Danlos can probably pull their skin and their neck out about 5 centimeters. Okay. Normal people can't do that. So
someone comes to your clinic, you think, ooh, they look a bit thin-skinned. Would you do that? You tell them to pull the skin out from their neck and see how they go?
Yeah, absolutely.
Right, and at what point do you say, I'm not going to treat you, you need to go and get genetically tested? Immediate?
If I suspect, I would do the full testing. Check like the Baton syndrome, the Baton scale. You would look for all the yes. skin issues and the bowel issues and the heartache
because presumably you can have more than one category of EDS, can you?
Yes. Well, no, you can't actually. No, you're one of the subtypes.
All right. So if I've got vascular EDS, then the Baton score is not going to be relevant.
Yes, very much. You're going to score 9 out of 9 if you've got vascular. Yeah.
Okay.
Pretty much. Yeah, they are much more hypermobile than pretty much any of the other subcategories. Most of them are really rare, thankfully.
Right. Okay. So sorry, I thought you said I couldn't be hypermobile and vascular. I thought you're either one or the other.
Well, you will have hypermobility.
Right.
So hypermobility is something that your body can do, but the other is a genetic condition that's caused by it. So every single Ehlers-Danlos syndrome are hypermobile.
Right. So then why is that a specific category, HEDS? If everybody with EDS is hypermobile.
Yeah, it's a good question.
See, this is the sort of thing that's confused me. I'm thinking, well, that's a specific type of EDS.
Well, I think there used to be 6 categories. Right. Back until 2017, they changed the criteria, and they realized that there were more categories, so now there's 13. And I'm not sure. I think the HEDS is the one that they don't really understand yet, and it's the biggest category because there's clearly some issues, there's clearly some comorbidities, but we haven't actually found the gene that codes for it like we have in the other categories.
Right.
So, but hypermobility is just one of the signs that you see.
Yeah. So with classical EDS, what distinguishes that from vascular?
So they're much more flexible as well than other sort of normal people or even HEDS. But they also have a lot more of the comorbidities. They will often have heart issues. They will often have gut motility issues. They will have the POTS, or they'll have the... there's a lot of people that have associated gluten intolerance or various allergies.